I think that's a great question. I think that the LGBTQ community is sorely undertreated and often uncomfortable coming into a traditional OBGYN office. So, some very simple changes include making your reception area more welcoming, having artwork that maybe represents the family of maybe, a family that has two mommies or, a pregnant person who might be celebrating their trans partnership and their family or in their representation, I think is really helpful and important. We also have tried to ensure that our front desk and our receptionist is comfortable and calm and ask patients reasonable questions like what their pronouns are, of course, but also what name they would prefer to go by, so that we're addressing a person who may be non-binary or who may be trans or who may be transitioning feels accepted. Also, in my own personal one-on-one, I try very hard to let the patient know that if I slip up with their pronouns, it is not with malintent, but it's an acknowledgement that yes, I am making an effort to be comfortable with you, and I hope that you trust me. The other thing that we also try to think about is that sometimes our patients who are LGBTQ, or especially if they're transitioning, may not feel comfortable sitting in our waiting room with others, different couples or a patient who's there with her husband during her pregnancy. So we might offer separate times of the day that might be a little more welcoming or more comfortable. So I think that's a very foundational place to start, is to just make that door open. To me, that's very important. I think that our specialty has a lot of catching up to do with women across all definitions, and remembering that there's no one size fits all, and that we really need to make sure that we ask the question, because a patient often doesn't come in with that as the first line issue, but if you ask, you will find out. And so, a patient who's LGBTQ, who's or perimenopausal, maybe isn't even being asked about contraceptive needs. So we certainly need to address that in someone who's perimenopausal. Or for trans men, that's often not asked as well. So we need to be open minded and ask questions about, well, what kind of sex are you having, and what kind of body parts do you have now? Because that's something that a lot of people may assume based on someone's initial appearance. But those questions need to be answered, of course, in a casual, comfortable way, which takes some practice and some integrity and some, compassion. I think natural birth control, especially for someone who's more seasoned, has been something that a lot of us have been skeptical of, knowing that women have very naturally irregular periods. No one's 28 days. And most of us, especially in my generation, are trained with hormonal birth control, barrier methods, the IUs, intrauterine contraceptive options. However, the technology is really there. And I heard an excellent talk today about a natural option that monitors temperature, pulse, and keeps track of a patient's window of fertility as well as her window of stay away, based on a really, really well researched algorithm. So I know that my younger patients are very interested in non hormonal options, as well as some of our cultural and religious populations.